baby. We're here today at Rejuvenate Mind Body Wellness Center. We're here to talk about postpartum depression with Dr. Scott Sims. He's inside, so let's go meet him.
Hello.
Dr. Scott, how's it going?
Great. How are you?
Doing good.
Wonderful. Well, welcome to Rejuvenate.
Thank you. Can you tell us a little bit of your background?
Sure.
How long you've been doing this and all that?
Right. We've been open at Rejuvenate now for about a year, and before that, we came from Nevada, Missouri, where we were in a group practice, and we were there for I was there for about 6 years, doing group practice. But then before that, I was in Joplin, finishing up all of this hoops that I had to jump through to get licensed.
How do you clinically diagnose postpartum depression?
Well, postpartum depression isn't actually a clinical diagnosis, but depression is. And all postpartum depression means is that the person is experiencing depression after the baby is born. And so women who have postpartum depression typically start experiencing symptoms right around the time that the baby is born, and then within a few months after the baby is born.
Do you have to have a history of depression to actually have postpartum depression, or can it be anyone?
It can be anyone, not at all. You don't have to have a history. Now, research has shown that people who do have postpartum depression are typically have problems with depression prior to having a baby. And so when you are looking for symptoms of depression, it's when somebody's coming in and talking to me and they're telling me I have a history of having problems with depression, so I'm a little bit worried about having depression after the baby is born, that is definitely something that we have to take a look at and screen for, make sure that we're on top of.
Can you actually treat somebody like that that's aware up front before the baby's
Absolutely.
born?
That's the best thing that you can do, actually.
Oh.
Is if someone comes into me and they say to me, I'm pregnant and I have had a history of depression, then I will say to them, excellent, let's make sure that everything is right in line and right where we need it to be by the time the baby gets here, so we don't get into any kind of postpartum issues.
Okay, so I guess you can actually kind of prevent it a little bit?
You can, yeah, you can prevent postpartum depression in lots of different ways. It's just the major factor is the person aware of having the issues? Are they aware of symptoms to look for? Different things that maybe family members are noticing, or maybe they have a history of depression and they know exactly what it looks like, and so that's always the best factors.
Okay, and is it most of the time, is this the mom realizing it, or it's the people around her? They can, hey.
Right. Typically, I mean, depends on how many times the person has been depressed in the past. So if someone has had recurrent problems with depression for years, they kind of know what symptoms to look for. Chronic sadness, where they just feel sad throughout the day, most of the day, every day.
Okay.
Something called anhedonia, which means that they generally lack a joy in life, that they just can't seem to find any pleasure in the things that they used to find pleasurable, like crafts or hanging out with friends or going out to movies or going out to dinner, or things that they really love to do.
Yeah.
They just don't want to do it anymore.
Okay.
And then, the more severe symptoms would be like suicidal thinking, feelings of worthlessness and hopelessness, and problems concentrating or decision-making problems. So just kind of being aware of those kind of symptoms is really important.